Hello, this is Dr. Akshay Metgud, consultant GI and laparoscopic surgeon at Metgud Hospital. Today we are mainly going to talk on role of laparoscopy in inguinal hernias. So inguinal hernias present with groin swellings. These swellings usually start with a small swelling, over a period of time progress. They typically give history of variation in size. Means lying down the swelling goes inside, but as the day progresses, as the patient starts walking, moving around, doing their daily activities, the swelling starts to become more prominent. This is a typical character of a hernia. In inguinal hernias, we can have various types. They can be direct hernia, indirect hernia, can be a complete hernia or an incomplete hernia, can be simple hernia and a complicated hernia. Now, typically, we do a clinical examination to determine what is the type of hernia, and apart from that, typically you would be advised ultrasound of abdomen and pelvis, and in some cases, if there is a need, even a CT abdomen and pelvis would be advised. When it comes to the management of inguinal hernias, surgery is the mainstay of treatment. Surgeries for inguinal hernia repair can be through the anterior approach or through the posterior approach. Anterior approaches are usually the open hernia surgeries, and posterior approach repairs is where laparoscopy actually comes into picture. When it comes to repair of hernias laparoscopically, typically 3 ports are placed and the hernia is repaired from behind. The basic principles of hernia repair still are followed. That is, the contents of the hernia are reduced, the sac is dissected, and once the hernia is repaired, a mesh is placed to see that it prevents recurrence. As with other laparoscopic procedures, even laparoscopic repair of inguinal hernias have similar advantages. So there will be no scar, the pain will be very minimal, the recovery time is significantly less, and patient gets discharged early and can get back to their daily activities much sooner. So with latest developments, improvements in instruments, imaging systems, energy devices, and exposure to quality training, laparoscopy has become safe and has very good outcomes. So because of this, the patients usually recover faster, they're discharged from the hospital in a day or 2, and then they get back to the work significantly quicker. For any doubts and queries, you can consult your doctor and take his expert opinion.